The National Food and Nutrition Commission has undertaken various studies. As you know, the National Food and Nutrition Commission has a very strong research portfolio, as a basis to advise government using evidence-based information. So the National Food and Nutrition Commission has identified very important determinants of malnutrition. The first determinant or cause of malnutrition in our country is poor food intake. The greater contributor to malnutrition is inadequate dietary intake, which is mainly as a result of poor food security at household level as well as at community level. That's number one. The second one is the disease burden, is also another important determinant of malnutrition, and poor care at household level and poor care at community level. So poor care looks at the ability to provide adequate food, adequate environment for the household, and of course there are other basic determinants that have been established as causes of malnutrition: poor water and sanitation, poor education or low levels of education, as well as poor environmental management, which involves water, sanitation, as well as social protection issues. So these are the major determinants of malnutrition in our country.
I've been diabetic since 2007. So if this is 2020, then it makes 13 years of troubled living. And my excitement about this opportunity is to share with another person that can avoid to pass through exactly what I have passed through.
It affected me on my business part because I used to travel a lot. What I'm earning now is not as the way I used to earn. It has affected my business whereby I can't order in bulk. I'm ordering locally, which is affected, actually has affected my business. Especially my, those days I used to make maybe 15,000 in a week. I can't make that money now.
It was a very hard situation because everything was changing in a very short period of time. It escalated very quickly. So it was a roller coaster, I guess. But then yeah, he went to the hospital, he came back, and then they had cut off his leg. It was so, one thing led to another. But it all started from the whole diabetes thing. If we had listened earlier and maybe, paid more attention to his diet, would have avoided a lot of things. So yeah, diabetes is very bad.
Remember, when a patient has been on medication for a number of years, eventually it predisposes a patient into another condition. They may end up having CKD or chronic kidney disease. So you're moving from one condition to another condition, which would take a number of years, and that is money. It's money on the healthcare system, it's money on the family to buy medication for this patient. And yet this can be prevented by a healthy diet, by eating healthy, deliberately choosing to incorporate foods, for example, legumes and vegetables and fruits, which have nutritious vitamins and minerals which help us prevent some of these non-communicable diseases, and engaging in some kind of physical activity every day for as little as 30 minutes a day.
So WFP is supporting the Healthy Diet campaign to increase knowledge about good nutrition and also safe diets. We hope that with the right information on the benefits of eating healthy, nutritious food, people can make the right food choices that can have a positive impact on their well-being and also on their health. WFP will work with the partners and also the private sector to continue promoting the production and distribution of nutritious foods to consumers.
We promote basically the neglected and underutilized crops, things like pumpkin leaves, may I say local assorted vegetables. We look at the products, those which have got the nutrients, which are quite high. Some of them we blend them in order for us to improve the nutrition aspect of it. As the private sector, we've got a big role. We are the backbone of the nation, and I believe that actually Zambia shall be developed by Zambians.
Ireland is committed to help the government of Zambia and its people to tackle this major problem. In the development of our current mission strategy, we chose to support the area of dietary diversification because we know that what people eat translates directly into the state of their health. Eating diverse and nutritious foods will ensure a healthy Zambian population. But eating healthy foods requires a shift in people's behaviour and attitudes as regards what they buy and eat. Ireland supports the Sun Business Network through the World Food Programme to develop and roll out this campaign, and I am very hopeful that the campaign will influence many people to relook at what they eat and change habits towards eating a more diverse and nutritious diet. I am happy as well to note that the Sun Business Network, through the World Food Programme, is also launching the Good Food logo. The Good Food logo will ensure that the private sector takes a leading role in producing and marketing nutritious foods. Again, the consumption of nutritious foods is a primary strategy in reducing stunting levels in Zambia. Finally, I would like to encourage every Zambian to take note of the messages that will be coming out of this healthy diet campaign that will help them make good and informed choices as to the foods that they buy and eat.
For a food to be called nutritious, it has to meet certain requirements in terms of the nutritional value. And so that is what we are looking at, and this is what has been set by the scientific committee. So we have a national standard on good hygiene practices, which is used to assess the premises. So when you meet these criteria, at least for the Good Food logo, you can qualify to put it there. And the logo will be used by the consumers to make informed decision on what type of health food they are looking for.
Now more than ever before, there is global recognition that nutrition is key to Sustainable Development Goals, especially Goal 2, to end hunger. But good nutrition is more than just ending hunger. It is also vital to achieving many Sustainable Development Goals, including ending poverty, ensuring healthy lives, achieving gender equality, promoting lifelong learning, building inclusive societies, and improving economic growth. We therefore must change the way people think and influence them to make the right food choices. As the United Nations in Zambia, we stand ready to support the government and partners to achieve this goal, with the aim of meeting the Sustainable Development Goals and ensuring that people make the right food choices each day to have a positive impact on their health, how they feel, and their future.
If the country as a whole would get to a place where it becomes fashionable to eat health, I would totally get to advise that all of us get very deliberate about what foods we are eating.